Hi, welcome to the Washington Post special report on COVID-19, the coronavirus. We're so glad that you can join us. I'm Libby Casey, and I am broadcasting from my home. So thank you for bearing with the new reality so many of us are facing, social distancing. We'll be talking to some of my colleagues in just a moment. I do want to bring you the latest news, though, and the latest headlines. The U.S. death toll has now passed 4,000, a grim and sad mark that we've hit. Florida has just issued a stay-at-home order. This is for 30 days. This is noteworthy because Florida was doing a bit of a piecemeal approach, and we all saw those images of people still partying at spring break and things like that. So Florida doing a more unified effort at this point. Also, there are some new rules from the IRS about who's going to get that stimulus relief. The IRS is now saying that people who usually get Social Security but otherwise wouldn't be filing taxes will have to file a simple tax return, and more information will be available about that soon. So we're watching that developing story to make sure that you know how you can receive the stimulus relief money that's going to Americans. We're going to talk about a variety of things today, including the question of face masks and face covers and whether we should all be wearing them. And also, we'll end the hour with some basic tips on how to get food safely in your house and how to make sure that you're grocery shopping safely, and what some of the best practices are from government officials and also health experts. But to start off, I'd like to welcome my first two guests. Emily Rahala, who's a staff writer covering foreign affairs, and also Carolyn Johnson, a science reporter, are joining our conversation here in just a moment. And you'll see them popping in. The important thing we want to start off our conversation looking at is some of the lessons learned that we saw from China, what was successful there, what was not successful there, and also truly how much do we really know about what's currently happening in China and how things there evolved. Emily and Carolyn, thank you so much to both of you for joining us. We're so glad to have you here. Emily, let's start with you. And I want to start with the present and then work backwards, because you were filing stories about coronavirus back in February, early in February, in fact. So let's just talk about what we know about the situation in China right now.
Right. So fast forward from February to now, what's happening in China, from what we understand, is that things are looking a lot better. The original epicenter of the outbreak, the city of Wuhan, is supposed to be coming out of lockdown on April 8th. So from January 23rd all the way till now, the city has been, pretty much completely shut down. People have been in their homes, no public transportation. And finally, things are starting to open up, and the Chinese government is recording a huge drop in new cases.
How trustworthy are Chinese officials' tallies? I mean, what do we actually know about their numbers?
Right. So there's really good reason for skepticism on the numbers. That's one thing. And there's also pretty clear evidence that things have gotten better. So I think we need to look at those two things together. The evidence that things have gotten better is pretty clear. A couple months ago when we were looking at images of Wuhan, the entire city was shut down. The streets were empty. We were getting sort of SOS messages from Chinese journalists and from people on the ground saying, the situation is really bad. People are dying in hospital corridors. And that's not what we're hearing right now. That said, there is really good reason for skepticism in terms of the specific numbers. The Chinese government is now reporting that there are no new local cases of the coronavirus in Wuhan. What that means is that any cases that are reported are coming from elsewhere, so people returning to the country. A lot of people that I've talked to, scientists, researchers, suspect that is not the case, that picture is a little bit too rosy, and we can talk more about the specifics on the numbers, but things are getting better. Whether the picture is as good as they say it is seems pretty unlikely.
Carolyn, as U.S. health officials try to figure out a best path forward and best practices, what are they looking at in China in terms of things that worked and things that didn't?
Well, the U.S. officials have been pretty clear that culturally we are different than China, and so they're not going to implement the same type of lockdown that they did there. But obviously, we are in the midst of an outbreak that is more like what happened in China than something South Korea or some of the other countries that were able to limit the spread with very aggressive and early testing. So I think every country is kind of doing like sort of a different experiment in real time on, and it's influenced by the resources they have, the culture, like conditions like the political will, there's all these different factors, and we're just kind of watching it happen, and everyone's got sort of a different approach, and there's no guarantee on any of these. You might run out of patients and goodwill or test swabs or whatever at some point, and it's kind of an unprecedented situation. So I think we're trying to learn, but we're also each country's doing its own version.
Let's talk about some of those decisions that countries are taking. So, Carolyn, can you describe for us one of the countries that you are sort of most looking at and most fascinated by in terms of, because I've been reading your writing, looking at the different paths essentially that governments have been choosing.
Well, I haven't been as close on the ground. We have all these great people in South Korea or Japan and China who are just much more knowledgeable. It's actually so hard to get information because a lot of this, no one's ever cared about diagnostic testing in the general public at this level. So it's almost like even really basic stuff about how tests work is suddenly like kind of newsworthy. So, South Korea, I think everyone has heard of the massive ramp up of testing they did. And that was very motivated, and China as well, by their experience with SARS and MERS, and especially MERS in South Korea, which is another coronavirus, but extremely fatal, and they did not respond as quickly to MERS in 2013 in South Korea, and that kind of taught them a lesson that we need to do this early. So they pursued a very aggressive and fast strategy to test a lot of people, and we're sort of getting to that now, much later for a variety of reasons. So that has been an interesting contrast. A lot of people asking, could we do that? Shouldn't we have done that? But, hindsight is also like a lot easier, and we are in the situation we're in. So I think we're trying to, head forward with as much information as we can. And I think there will be a ton of study of this. We're just learning everything that, could be a shortcoming of our system right now.
Emily, can you compare that approach to Japan's approach?
Yeah. Again, I haven't been on the ground in Japan. They face some criticism for being less swift on the testing front, and things there have not been locked down to the same degree. My broad sense is that there was a sense that might be working, that the number of cases were not rising rapidly, and now the Japanese government is rethinking that. In Hong Kong as well, the situation looked to be under control. A bunch of people have returned to Hong Kong, and now there's the big question is these sort of secondary waves. So all of Asia is sort of dealing with this on different timelines now, but offer different windows into what the US might be facing in weeks or months.
Emily, I'd like to get a better sense of what exactly China did in terms of lockdowns and things like that, because we're all learning the nuances of terms like stay at home, versus,
Right.
a shelter in place versus a true lockdown. So now that we all have our own sense of what the United States is doing and what different states and localities are doing here, tell us more about what exactly China did, because I feel like I can now compare my experience a lot better with what other countries have done.
Right. So let's go back to January. China reports is January 1. And for the first 20 days or so, they reported to the WHO on January 1, rather. For the first 20 days or so, it's denial. Local officials are saying everything's fine, keep circulating, go to your Chinese New Year party, and life continues as usual. Then around January 20th, the government swings into action. And on January 23rd, that's when the first, lockdown of Wuhan happens. And it was at the time, and I still think possibly till very recently, the broadest, most extreme lockdown or quarantine, at least in recent times, in decades. The city of Wuhan was completely sealed off from the rest of China. And at one point, more than hundreds of millions across China were locked down. And what that meant was, especially the closer you got to the epicenter in Wuhan, was, literally locked down. People were in their apartments. You had to get sort of a hall pass to leave to go get groceries. Eventually, in the center of the outbreak, the food became centrally distributed. But there's a few strategies that I think are now being considered in the United States, and questions like, how do we encourage and or compel people to stay in their homes, to not leave, to only leave for true necessities. Another strategy that the Chinese government used was sort of forcible quarantine. The government realized that by quarantining at home, people were infecting their families. So eventually people started being either voluntarily or by forced into separate quarantine facilities where they were with other people who were sick, whether or not they had the coronavirus. The Chinese government also, with some success, was able to surge medical equipment. Eventually, there was severe shortages at first. They were later able to surge ventilators, medical personnel, protective gear to the center of the outbreak. Another issue that's coming up right now in the United States.
So there's this question of how you can do massive measures on the scale that China did without fundamentally violating people's human rights and taking the choice away from them. So what are researchers here in the States talking about and thinking about in terms of how you change the messaging or change the method of trying to change people's behavior, Emily?
Well, a lot of people that I spoke to about what China did said, listen, there's lessons here, but the heart of what worked for them, part of that doesn't violate human rights. So things like, aggressive testing, tracing the contacts of those who are known to be infected, quarantining people outside of their home so that they do not infect their other family members. All of that can be done in the context of a democracy. Perhaps not to such a severe degree, but it can be done. The tougher questions are, what do you do when people are not leaving their home to be quarantined? What do you do when people violate the order to stay home? And in China's case, we saw, very serious human rights violations, videos of people being literally dragged away from their family to a quarantine facility. We saw people who were not sick or did not believe they were sick being quarantined by force. So researchers are weighing, how do you adapt techniques that seem to work to a society that is not willing so far to take that kind of measure.
We saw Governor Cuomo just today at his briefing say that police in New York may need to get more aggressive in trying to make sure that people adhere to the rules about like not going and doing like a pickup basketball game and not gathering in large groups. So we're watching people in leadership here in the States struggle with this. We did see a containment zone set up, the first one in the United States in New Rochelle, New York, where we saw that outbreak pocket. But the residents were still free to move around. So Carolyn, can you give us lessons learned from that? I mean, the idea was that public gatherings were canceled, but it's not like there were like barricades and military tanks barring people from coming in and out of New Rochelle, New York.
Yeah, and I think something more along those lines is what we are seeing. Of course, we have like just a very piecemeal response where you see states or even regions kind of coming up with similar strategies, asking people, to divide themselves into essential and non-essential, and to make decisions less by kind of force. I mean, US officials have said they just don't think Americans would be okay with, having people removed from their homes the way they were in China. And I know, China has talked about that as a really a key to one of their key successes. So we will see how that goes. But we haven't had these large quarantine centers just for people who have really mild illness to all be in one spot away from their families. And you can see why that would be difficult for a variety of reasons here in the US. So I think we like in the US, you're even just seeing very different experiences. California, the West Coast began social distancing earlier than the East Coast, and they appear so far to be having a less intense outbreak. But it also depends how long people agree to this kind of thing, because I think at the beginning people feel like I can take a certain amount of inconvenience and sacrifice. But once people are holed up in their homes for a long time and things have been going on for weeks and weeks, you might get less compliance. And that's where in a situation like China, where there's just more, mandatory temperature checks and things like that, you're probably going to get better compliance, I guess. But we also don't know, like it depends on trust in government, which is not necessarily going to be, an issue. That could also be a problem if you have more of an authoritarian government.
Um, Emily, let's talk about how much transparency there actually is with China, because we are looking to China so much for lessons learned, obviously. And you've reported on how just last month, China announced it was going to expel American journalists working for our organization, among others. The Chinese said that was in retaliation for limits that the US was making on some media here, but take us through what the implications of that are and what that actually means for information flow.
Sure. I mean, we need to see the Chinese data in this case as, extremely limited. We don't know, and we don't know what we don't know. We need to see this in the context of a Chinese government that has, over the recent years become increasingly restrictive in every aspect of information control, whether that's the censorship of the internet, expelling foreign journalists, and its own sort of propaganda efforts domestically. What we know about the numbers, I've been talking to both China experts and scientists since late January on this, and they've said since the beginning, like, the data that we're getting is not complete. We need more information about the onset of cases, the onset of symptoms. We need information about how many doctors are getting sick, what day they're getting sick. And a piece of reporting I did, I believe in February, showed that China had not disclosed critical information about doctors getting sick to the World Health Organization. So I think China is the one example we have in many ways right now, but looking at the actual numbers, comparing numbers with China, it's really not effective because the figures are very likely much, much higher. We just don't know how much higher.
We're grateful to get to talk to you, Emily. You were a longtime correspondent in China, and so you have a lot of contacts there, and you've been able to report out this story from here domestically in the US. But, I was looking back into your archives, and February 1st was the first time I saw you reporting on the coronavirus. And as you mentioned, those early missteps that were already being recognized there. As you've watched this unfold since February 1st in your own reporting, have you seen the US make similar mistakes or different mistakes as we've been slow to evolve on this?
It's a great point, because one of the strangest things about this, for so many of us who've been covering this since January, really, the Post's first story, I believe, was January 8th. It's to watch this very similar things unfold, and the same tragedy essentially unfold twice. So in January and early February, I was watching, as I said, sort of SOS messages coming out, Chinese journalists trying to report stories on this outbreak, getting censored. We saw people getting detained for speaking out of this outbreak. And then we saw urgent messages about shortages of equipment. Then we saw messages about doctors getting sick. Then there was questions about ventilators. I mean, really the entire tragedy of Wuhan unfolded before our eyes, and we were covering it. And then we saw it play out in Italy again. Shortage of equipment, doctors sending messages, questions about quarantine. And now, 3 months later, it's happening in the United States. And it's quite striking and frankly, very painful to watch.
I have one question that I wanted to share with both of you that came in from one of our readers. Kathleen wrote in from Manchester, New Hampshire, asking why the US is not doing comprehensive contact tracking. So Carolyn, can you talk to us about what that would actually do? And then Emily, I'd love to hear from you a comparison of how other countries have been using that as a technique.
Sure. Well, that was our initial strategy. It was that we would keep the cases out through travel bans and travel restrictions, and that every case that we would identify, which would be an imported case, we would then go make a family tree of everyone that person had a close interaction with. It could be their family, did they go to a sports event, everything, did they go to the store, did they go to the gym, and then find anyone who they had close contact with, monitor those people for symptoms. And so it's just a very labor intensive process, and some places are still doing it, but it becomes very difficult when you have large numbers, because eventually the family tree of interactions becomes so gigantic that you can't, that's when you sort of begin social distancing. Everyone kind of stops trying to interact with anyone outside their family unit or kind of core group. And so it just becomes really taxing. I mean, we might need to build up more of that capacity. And I think that's something people are kind of working on, like how we're going to get out of this in some ways. But at this time, when there's like a rapid escalation of cases, when you're talking about like rationing ventilators and rationing testing, because you don't want to use a swab on someone who, you know, and put a healthcare worker at risk and use a mask up. You know, given the shortages, we're just not doing that, and it is a very labor intensive process. So it's not clear, you know, when we would start it up again. But I don't think during this time of kind of like exponential rising cases and a lot of deaths that that it's going to be feasible in the US.
Yeah. Emily?
I mean, she's exactly right. This is a strategy that was used very effectively when it was started in January. So the countries that have had success with contact tracing include, you know, Singapore and South Korea, where I think as of the third week of January, there was awareness of, you know, tracking people who are coming in from Wuhan and from China more broadly, using the tools such as, you know, electronic surveillance via cell phone, self-reporting, filling out questionnaires. Singapore actually has sort of crack teams of sort of virus detectives who are helping trace who everyone interacted with. But this is a strategy that's used in the early part of the spread of disease. And now that the systems are overwhelmed, I think it'll start being part of the strategy again once things are more under control. And perhaps, as you know, if there's secondary outbreaks, the United States will turn to it again.
All right, Emily, Rahela, we're going to let you go, but Carolyn, stay with me for a few minutes because I have some more questions I want to throw your way. You've been reporting on some fascinating technology and science that's going on to figure out just how there could be some progress in either protecting people or healing people or helping people. We all know that looking for a vaccine or a cure is the ultimate end goal, but we've heard the timelines of those. So talk to me about serology, because you say this has become the new pandemic buzzword. What exactly is it?
It's basically a blood test. It's called serology because serum is just a part of the blood, not the whole product. So, and the serum contains antibodies, which are these virus-fighting parts of your immune system that come up after you're infected. So serology testing, which is basically a blood test, has become a linchpin of basically every kind of every plan to get out of this sort of says, this would be a great kind of thing to do, a wide scale testing to find out who has antibodies. That means those people would most likely, and this is one of the unknowns, we don't know, would have some immunity, potentially complete immunity, but it could be partial, it could expire after a certain point. But anyway, this could be kind of superheroes could come back, restart the economy, be on the front lines of delivering medical care because they would not be at risk of developing the coronavirus. So it's just another layer of testing that everyone is very hopeful about, but it also, testing, as we know, is kind of a complicated logistical thing that can go wrong. So they need to kind of figure out the best use case. And there's like never been done before, like at a large scale that I'm aware of. And so there's a lot of questions about when you do this testing, how widely do you do it? Who pays for it? Who delivers it? How do people tell the world, you know, like their status? And does that become problematic in its own ways? So there's like a lot of hope for it. Another use of it is to identify people who have antibodies, because there's kind of a long history in medicine of using serum, which is, you know, the rich antibody rich part of the blood, to help people fight off or prevent disease. So that's being tried at a lot of hospitals. They're all kind of spinning up their own clinical trials and getting their systems in place, but a lot of them are kind of tracking all the COVID survivors they know, because they want them to donate plasma and hopefully be able to save lives of people who are infected in the future.
What's happening in Telluride, Colorado?
That is a kind of it's a beautiful ski town, and it's just very, it's a small town, and there are some biotech executives that live there and are doing serology testing, offering it to the residents. So, I mean, it's just kind of a weird artifact of the fact that like these two CEOs live there. So it's not really scalable to everywhere else, but it's an interesting kind of thing that's happening. They're offering tests to people. These are not diagnostic tests, so they're not meant to like tell you you have this now. But anyone who is getting a positive is being asked to take a second test to see in case they have an active infection.
And I mean, it's so fascinating because I would imagine we'll learn then if the information is public and released, you know, having a small population and getting in data from that small population can maybe have some practical impacts. I want to welcome Joel Achenbach joining us, science reporter. You look like you're in Telluride, Colorado, Joel, right. But I think you just, you've mastered the Zoom technology of making us all be in a place where we wish we were.
Yeah, that's the Snake River, and those are the Tetons in the background. But
fantastic. Yes. Joel, I want to bring you into this conversation. You know, we're seeing some localities and the FDA try to figure out ways to just start doing some kinds of tests, help some patients in some way. The governor of New York announced that his state is going to try to treat patients. You know, the FDA is announcing some experimental treatments. We're seeing Bloomberg Philanthropies, the state of Maryland, throw in some money into the effort. So can you join in with Carolyn here to talk to us about what it would be like to try to help a patient who might have coronavirus with something from a patient who's recovered from it?
Well, I can tell you, I talked to a couple of people today who had it, who were tested positive. They're over it, and they're in this awkward period where they would love to give plasma or do something. It's very confusing about when are you free? When are you over it? There's sort of different ideas about what the standards are for when you're, post-COVID. That's going to be a growing cohort of people. And they want to help. I mean, they want to somehow be part of the solution, as Carolyn said. These superhumans who've been through the war and have come out the other side. So the problem right now is in terms of ramping up these different capabilities. And Carolyn did a great job of explaining serology. You can't just snap your fingers and have it work. I mean, does the test even work? We talk about a vaccine. You have to test it, otherwise you don't want to accidentally kill a bunch of people with a vaccine that's supposed to save them. So there's no magic to this. It's kind of a plodding scientific trial and error situation. And in the meantime, the one thing that really we can do that does work, we think, is social distancing, which is low tech. It's just staying home, and it will work. We have a story that went online today at the Post from our San Francisco bureau, where they haven't had an explosive number of cases because back on the 16th of March, they had an early stay-at-home order, and so they haven't had that really steep explosion that you saw in New York. I guess that I've a long roundabout way of answering your question, which is that this low tech thing, just stay at home and limit your interactions, cut down your contacts, that will really help. And it works in theory, and it's not very complicated to explain.
It was a worthy answer. So thank you. I want to follow up with a question from Gus, who writes in from Wisconsin, who's asking about, can you get a COVID-19 test to see if you already had the virus? So maybe you had it or you had the symptoms of it a couple of weeks ago. What do we know about the lifespan of your ability? Emily, I'll start with you. I'm sorry, Carolyn, I'll start with you to be tested, because I'm sure you all have heard of these cases of people who are like, I think I have it, but my doctor's advising me not to go get tested because of a testing shortage, because it might put me and the testers at risk. So if someone like Gus wants to try to help out, Carolyn, what are his options?
Yeah, well, that's the serology test is for those people. It's a way to tell if you had it. It might determine if you have it, but it's more like if you had it. and you don't know it. It's also a way of getting a sense of the true fatality rate, because once we can do kind of mass or surveillance screening and we have an idea how many true cases there are that we haven't detected, we'll have a better sense what percent of people are really dying. Because right now everyone thinks maybe the fatality rate's a lot lower than we know. However, I will say that these plasma tests right now, because they're experimental and because they're spinning them up, the ones that I'm aware of are requiring you to have had a nasal swab. So, because those are very accurate tests, and there's, there is just a lot of, they're setting all these systems up. I know everyone wants to help, but like right now they're setting their criteria kind of just sharply for inclusion in these. They're really clinical trials, they're experiments. So they want to make sure that, they're getting people who they're almost certain did have COVID. And then what they have to do is they're not just going to give the plasma from a person blind. They have to like make sure it doesn't have any other diseases in it, make sure it doesn't have live virus in it. And they're also going to look for people that have a high concentration of these antibodies that kill the virus, that neutralize the virus, because they don't want to they want the most potent stuff to give these people. And they really want to make sure they're not just, giving people like too low of a dose that won't work because, it's just not enough.
I think that the answer to Gus's question is no at the moment, in part because they're saving the tests and the processing of the tests for people who are sick. Sounds like Gus is not sick, might have been sick, or knows someone who might have been sick. He's not going to get tested.
Carolyn, before we let you go, you did a piece about how if you did have symptoms and you were tested and got a negative result, it doesn't necessarily mean you didn't or don't have COVID-19. So can you explain that for us?
Yeah, so even though these nasal swab tests, which look for kind of like a genetic fingerprint of the virus, are quite accurate compared to some other kinds of tests, every medical test is not 100% accurate, and they all have kind of a different level of both false positives and false negatives. And one of the problems is that we don't know actually how accurate the tests are because they are new, and like you need to have this kind of gold standard way of telling how sensitive and specific the tests are. So that's the first thing. We just don't know how sensitive and specific they are. There's like all these kinds of estimates and stuff. People think they're pretty good, better than they were in China, but yeah, we just don't know. So one of the big concerns right now is flu is going down because we're getting later into the spring. So and this virus is going up in the community. So the underlying chance you have this is increasing. And so if you get a test and you get a negative, there's a lot of reasons it could have been negative. Those include that the swab is like they stick it like really far back up your nose, like into your brain. It feels like your brain's gonna fall out.
Can I ask you guys, I've gotten flu tests before. Is it like the flu swab or is it even worse? Because the flu swab is not comfortable.
It's the same one. It's the same one, but people don't always.
I mean, and let me point out that I would not be able to administer that to myself, right? Like a medical professional needed to do it because there's no way I would inflict that on myself unless I had to.
It's one of the things that it's made them hesitant about these stay-at-home tests, which in theory would be great if you could do an accurate test at home, but because no one's going to do that to themselves, or most humans would be incapable of doing it well. So if you do a bad swab, like no test in the world can detect the virus if you didn't do the swab correctly. And then also the virus can take a while to kind of be in large numbers in your body. And so if you do the swab too early before there's a lot of virus in the back of your throat / nose, then you might just be negative for that reason. And then there are other kind of issues, laboratory error, handling, like other kinds of natural reasons tests miss cases. So it's just like, if you have symptoms, like you should probably just assume you have it. And if you have very mild symptoms, everyone is staying at home, I think pretty much, at least where we live anyway. So I guess for the greater good, I would just try and kind of self-isolate and, hopefully you don't have more serious symptoms. But even if you just had the flu, I mean, the flu is terrible and you don't want to spread it to your family and friends. So just act like you have it and stay at home and get well.
And can I just add one thing to that? I mean, that's exactly right. The symptom that we're always told to look out for is if you really have problems breathing. If you're in distress, you cannot breathe. Now, obviously, a panic attack can cause that, and this is all scary. A big part of this crisis we're going through is the psychological challenge of it for everyone. Just the anxiety we're feeling. It's challenging to sleep through the night when you don't really understand the virus. We don't know who's going to get sick. We don't, if you're going to get sick. But if you do get sick, most people do not need to be hospitalized. I mean, the overwhelming majority, upwards of 80% at least. And the people that we've talked to people who've been sick with COVID, and they, many of them, it's just been miserable. I mean, they have fevers, usually not too high, but they have fevers. It can be terrible muscle aches, and they can develop a cough. But as long as you can breathe, you don't need to go to the hospital. And that's the symptom you got to watch out for.
Yeah, and I want to point out that Mayor Bowser in DC said that, if you can't breathe, go to the hospital, seek medical attention, because
That's
they
right.
are concerned that people won't take that step out of fear or out of concern for others. Carolyn, we have extended your stay far longer than we promised you, so I want to let you go. I'm Carolyn Johnson, science reporter. Thank you so much for all your hard work. And we saw a little cat head pop up there, so thank your cat for sharing the couch with us. I appreciate your time today. Thanks, Carolyn. Joel, I want to ask you about masks, because we're seeing this evolving conversation happen on a national level, not just among journalists and people trying to learn best practices, but from officials as well. So I want to talk to you about the latest on the utility of masks and who should be wearing them. And let me just point out that James Hohmann is joining us, national political
Hi, James.
reporter. James, hi.
Hey, Joel.
Hey.
So let's talk masks, Joel. What's the latest?
Well, keep in mind that the idea of wearing these masks or some kind of facial covering, a courtesy covering, it's not to keep you from getting sick. It's to limit the amount of respiratory droplets that you might be spreading. So it's to help other people. And it's sort of the idea is that it reassures other people that you're taking steps to limit how infectious you might be. If you're sick, you should not go out. If you have any symptoms, you should not go out with or without a mask. But if you're healthy, you feel fine, what should you do? Should you be wearing a mask when you go to the drugstore, when you go to the grocery store? And a week ago, I didn't see many people wearing masks. In the last few days, I live in DC, the last few days, I've seen way more people wearing some kind of facial covering, because I think this is just kind of a grassroots idea that we need to be wearing masks. There's been a lot of articles about it, a lot of pundits and influencers and some scientists here and there. The CDC is considering making a more formal recommendation about this. I don't know exactly what they're going to say. They're probably not going to say you need to wear a mask when you're going from the dining room to the living room, or if you're just going out to walk the dog on the sidewalk. I think it's about if you go into a public place, like the drugstore or like the grocery store, that you should probably cover your face. I think that's what they're looking at. But they have, to my knowledge, unless they've done the last hour or so, they haven't made a formal recommendation.
There is this idea that if we all wear masks, then it doesn't stigmatize someone who might be unsure if they're sick. It also doesn't stigmatize someone who might have pre-existing health conditions where they really need to try to protect themselves and do anything they can to protect themselves. And we've heard so much, James, about people being asymptomatic and yet still being carriers. And so if we all wear masks, it does, imply that there could be less transmission, because that one person out of 10, perhaps, that could be sort of a silent carrier wouldn't be able to have those droplets leave their mouth so easily. James, do I have you?
I'm here. Yeah, is that for me?
Yeah, just sort of bring into things.
It's good to be with you guys, and I've enjoyed listening to Joel and Carolyn. I went to Trader Joe's yesterday, and I wore a mask for the first time because I read our reporting on the CDC considering this, and it does give you a false sense of security. I think you're absolutely right. If everyone wore a mask, you're breathing less. It's really to protect other people as much as yourself, because if you're, putting out particles. But it is, you just kind of, when you have a mask, in my personal experience at Trader Joe's yesterday, you obviously made great efforts to social distance, but you end up just kind of getting closer to people, because it does give you this sense of comfort and security that is not real and does not exist. You're still vulnerable to people. And it is, culturally, what's interesting is a lot of the Asian countries did recommend, Libby, that people do this. Hong Kong has kind of a culture where people wear masks. And the evidence does support that it did slow the spread in Hong Kong. And people are very comfortable with that there. The World Health Organization still says if you're healthy, you do not need to wear a mask. And so it'll be really interesting. The CDC has sent draft guidance to the White House for approval. The president was asked about this last night during his news conference, and he said, yeah, why not? If you have a scarf or a bandana, there's no harm wearing it. It'll be interesting if they formalize that. And it'll also be interesting if our government does that, if the WHO follows suit.
Molly wrote in and said she needs a how-to guide on family mask wearing, and she wants to know something you were just getting at, Joel. Do you wear them around your house, or do you wear them outside? What do we do for kids? She also wonders. Now, I will point out that I saw a bicyclist on a lone path with no one around, and the poor person was like wearing a mask. And I thought, now is not the time. You're making it harder for yourself to breathe, but because there was no human being to interact with. So I wanted to pull over and say, save the mask for when, you're around me. And because I don't want to get you sick. So Joel, give us some what we know about the mask usage.
Well, first of all, Molly, that's the really good question, because kids might be a little different than a grown-up, because kids run around and they climb all over things, and maybe you'd want to give the kids a mask in circumstances where you wouldn't do that for yourself. I do believe that what the CDC is talking about is people going into public spaces, and certainly crowded public spaces. The metro or the subway in New York is a different kind of environment than walking the dog down the sidewalk, I believe. And so the guidance might get into that subtlety. I'd say, in any case, it's likely to be advice from the CDC and not some kind of mandated situation in which you're going to get arrested if you don't have a mask. That is my what I anticipate in this regard, in part because culturally we have not done that before, as James pointed out. There is the danger that it makes people, lower their guard and think, well, I've got a mask, now I can go do whatever I want to do. I mean, certainly what you want to do is limit the amount of overlap you have with other people, the amount of contacts you have. And if you can indulge us for a second, there's this thing, the R naught, the reproductive rate of a viral infection. So if you have one person who's infected, how many people, let's say I have an infection, how many people am I going to infect? You look at the China numbers, the numbers are something like 2.5. They could be a little higher, in fact. But that was early in the crisis, before anyone knew what was going on, before they realized what a crisis this was going to be. You had people not take as many precautions. And once they imposed restrictions in Wuhan and other places, they drove that R naught down below 1, and that's how they got control of the epidemic. So it's a really simple concept in a way, which is, drive down the number of people you might potentially be infecting if you're sick, and then that should help limit, flatten the curve and limit the spread of this thing, even though we all remain potentially vulnerable to it because we don't have immunity to it.
Teddy writes in from Berkeley, California, asking for instructions for making useful masks at home. And we will point out there's been a huge call, obviously, to get those N95 masks in the hands of medical professionals so they can protect themselves, because they are really just in the situations where they are right in front of and getting potentially direct contact with people who are very sick. And so there are instructions online. The Washington Post has some. My colleague Ali Karen in the video department, just a video about the how-to. Joel, before we let you go, do we have a sense though of how useful these ones that we're making at home are? Or James, I don't know what you were wearing yesterday, but I'm kind of picturing you like a mask.
You have one, James? Show us.
I don't have it right around here.
So Joel, how do we know about the effectiveness? I mean, I guess anything's going to stop those droplets, right?
Well, I think that they may have more of a psychological function. I don't know that there's any science of how well a homemade mask works. They're definitely, here he comes. What has he got?
It's nothing fancy.
Where did you get that?
So that's just like a surgical,
It's just a regular surgical mask.
Okay. All right. Okay. There you go. Well, we still recognize you guys. But so, I'm a science reporter. I've never seen a scientific study about homemade facial coverings and how they work in terms of stopping the spread of respiratory droplets of COVID-19. We'll see that study eventually, I anticipate.
Yes, that's such a great point. Thank you, Joel. And as we were talking about, a lot of this is to keep your hands off your face. If you've got a mask or gloves or something else on, it forces you to not touch your face. You're just more conscious of it. And also there is that potential if you're layered up well enough not to be putting out your particles in other people. So Joel, we're going to let you go. Thank you so much. James, so many questions have been coming in about this question of supplies, of course, and where the supplies are for the American medical workforce. And someone did write in, Joyce wrote in from Houston, Texas, and asked, why was the US sending some medical supplies out to China when there were still concerns? Let's see, did we lose James? We might have just lost James, but we kept Joel.
You kept me. You jettisoned James. Good.
Joel,
good
not
choice.
that I don't love seeing you, but we are going to let you go.
Okay, I'm going to hit leave meeting. All right.
Okay.
Thank you.
Thank you so much. So we'll bring James back in just a moment. And we'll also be welcoming our colleague, Mary Beth Albright, coming in. And Mary Beth's going to talk to us more about some of these like practical tips and ways that we can be protecting ourselves. So James, I'm so sorry that we dropped you.
No problem. I'm here.
I don't want to say it was because you looked scary in your mask, because you didn't at all. You looked totally normal, and we are all really getting used to the new normal of seeing people in masks. So, James, what I wanted to ask you though is this question about medical supplies, and there's been such a crisis and we're seeing these, just horrific and heartbreaking videos of healthcare workers risking their jobs even to tell the true stories about what's happening in their hospitals and whether or not they have gear. So Joyce wrote in and asked about medical supplies and how some were being sent overseas to China specifically early on. And let me just say hi, Mary Beth, hang with us here for a minute. We're going to talk to James here about supplies.
Yeah, so this, early on, I think that there was, the government dropped the ball. People didn't appreciate that this was going to spread. They didn't see this as a US problem. They saw it as a foreign problem. A lot of the material that was sent overseas was sent by non-governmental organizations. So there was official kind of US government foreign aid support, but Samaritan's Purse, the group run by Franklin Graham, sent a lot. And it is, it's very much in fitting with the United States' conception of itself, in the post-World War II era, that we help out countries in need when they have typhoons or natural disasters or earthquakes or, man-made crises. And so, and some of it for, kind of, for lack of a better term, propaganda purposes to show we're helping the Chinese in their time of need. But there, what's interesting is the federal government's so immense and huge that USAID, the U.S. Agency for International Development, sort of has its own budget, has its own supplies, and their mission, their literal job, their sole focus is helping other countries. And so what's happened in the last couple of days is Thailand, for example, the U.S. called Thailand and said, hey, do you have any supplies you could send us? And Thailand said, you're sending us a huge shipment of supplies that's supposed to arrive tomorrow. And so then, one hand of the US government wasn't talking to the other. All of a sudden, it turns out USAID was sending a plane full of stuff to Thailand. Vice President Pence ordered the plane to turn around, come back to the US, bring the supplies back. The coronavirus task force at the White House has now decreed, we're not sending any more stuff overseas as we had been. One of the things that has not happened yet, though, is that the US government has not, even though they have the ability to, told companies that are making masks not to export them and to sell them overseas. So there are massive orders, of private entities and foreign governments ordering masks from companies like 3M that make them, and they're fulfilling those orders. Now the U.S. companies are ramping up production. They're going to 3 shifts. They're bringing on new machines. They're repurposing machines that had been used for other purposes. But we do have this shortage, and frankly, that's one of those other things that's important in the context of what we were just talking about, Libby, with my easy surgical mask. This isn't taking anything from anyone on the front lines. Those are easy to get at any store. But it is not a good idea for regular people like us to use the N95 masks, because there really are limited numbers of those. And there are nurses and doctors who are treating people at risk themselves because they don't have those masks. And so that's why it's so important to kind of prevent those from going overseas and to not be shipping them overseas. It does feel like the government was behind the 8 ball. The response has been uneven, but they are kind of catching up and making this not just rhetorically, but actually a whole of government response.
James, before we bring Mary Beth in, I just want to get an answer to this, if you know this. Is it within the government's power to stop private companies here in the US from fulfilling orders? Like if people overseas are ordering N95 masks, does the government have the power to say, no, this is essentially a wartime effort. They need to be funneled here domestically?
Yes, absolutely. And that's what the Defense Production Act allows that. The Defense Production Act lets government do a lot of things. It kind of lets government go to the front of the line for buying, but it also does allow for export controls in wartime. And the Pentagon has used that, not during kind of national emergencies like this, but to say to a company, you can't export this rare earth mineral to China because that would help China make this weapon against us. The government does that kind of thing all the time. And so it's the same legal principle that would apply to masks.
All right, great. Mary Beth, it's so good to see you. We're getting these updates now from a lot of federal agencies about guidelines as this is all evolving. And we are getting updates specifically from the FDA on how to keep ourselves and our families safe when we go to the grocery stores, when we food shop. And there have been a lot of questions about that process. I've seen so many people writing into the Washington Post and asking, how do I know that I'm handling my groceries in a safe way where I won't be bringing the virus into my home? What have you been learning?
Absolutely. And it's all of us, all of we people on the ground who are trying to mitigate our own risks every single day, minute to minute, right? And so the FDA actually updated their guidelines on Friday afternoon, and there is no evidence that food or food packaging has caused any transmission of coronavirus at any point ever. And I know, when you hear that, you think, oh, well, that's interesting, but it's a novel virus, right? We don't know a lot about it. That's why it's novel. And we're trying to learn about it, which is true, but we know a lot about coronaviruses generally and respiratory illnesses. And the way that the main driver of transmissions is from person to person. So I love that James and Joel before were talking about the ways that masks or face coverings can then give you a false sense of security, because I do hear about people bringing their groceries inside and disinfecting cans, and there's no harm in that unless those kinds of actions keep you from doing the social distancing that is absolutely crucial for this. And as Joel was talking about, the Washington Post just had an article, I think about an hour ago, about how effective social distancing now, how effective we know it is. And so when you go to the grocery store, I live in DC, I have a couple of markets around. People are not, there's pink tape down. People are not standing the 6 feet apart from each other that they need to, in line, going into the store, going out. And I think that when you wear a mask or gloves, it absolutely gives a false sense of security, but it also sort of could give you a heightened sense of, oh yeah, things are not normal right now. Mm-hmm. This is not what things were like a month ago. Mm-hmm. And because there are people just walking by each other in the grocery store. And so yes, touch only what you plan on buying at the grocery store. Have 2 weeks of food on hand. All that stuff applies. Wash your hands all the time. But most important is the social distancing and really focusing on that.
What about takeout, Mary Beth?
So it's interesting because, once there was a New England Journal of Medicine study that came out a couple of weeks ago that's sort of like the benchmark of what everybody's talking about, which is that it found that that coronavirus can live, it can live 24 hours on cardboard and 2 to 3 days on plastic or steel. So immediately people are thinking about car door handles. They're thinking about cans that they buy at the grocery store, that kind of thing, which is true. But although it's detectable for 24 hours, it's not necessarily something that's going to infect you for 24 hours. And just touching something, like let's say that a delivery person coughs in a specific area of a bag. They leave it on your door, you open the door, you're practicing social distancing, you pick up the bag in exactly that same place. If you wash your hands, don't touch your face, don't transfer the virus that way, you will not get infected by it. And so by taking the food out of the packaging, you can throw away the packaging if you'd like, but disinfecting bags is something that is not going to, it might feel like you're doing something, and I totally get it because I am at home with my 12-year-old and we all want to feel like we're doing something. But the best thing you can do is mitigate your risk in other ways.
James, I want to circle back to some of the other news stories we're tracking and following here. And Mary Beth, if you don't mind, if you can stay with us for a little while.
Happy to, yeah.
We had a question come in, James, and ask about Russia specifically, which was a very interesting question. I'm going to pull it up here now. Marjorie is writing from Rehoboth Beach and asking, why aren't we hearing more about Russia and the number of cases and deaths? And I'm interested in the latest on that.
Yeah, so the Russians have been lying, and they have been misclassifying COVID-19 cases as pneumonia cases. So we've seen a huge spike in pneumonia cases. This is a classic kind of Russian thing. Last week, Vladimir Putin went to a hospital where coronavirus patients were being treated. He said he had it fully under control, went in wearing a full hazmat suit. Yesterday, the news out of Moscow was that the doctor who showed Putin around that hospital has tested positive for coronavirus and is actually pretty sick. And the mayor of Moscow, a Putin ally, has criticized, which is very unusual for them, their response to the government's response. And so Moscow is now sort of increasingly moving toward lockdown, and they have issued a bunch of orders related to lockdown. We expect that's going to extend sort of nationally. The thing about Russia is, it's right on the doorstep of all these places that are getting hit really hard. It's both an Asian country and a European country. It bridges the two. And so it stands to reason that they're going to get hit pretty hard, and their medical infrastructure is relatively weak. It's much weaker than ours. The question is reporting on the cases. And the other thing is that, we talked earlier about us sending stuff to China. The Russians made a big show of sending a plane of some supplies to the United States. And if you watch Russian state TV, they're making a big deal about how they're helping the Americans because the Americans need Russian help. And they're kind of trying to score some propaganda points off that. They're also playing in heavy circulation. During his news conference the day before yesterday, the president said, I really want to thank Russia for helping us. And that clip is playing over and over again on Russian state TV. So they kind of try to think of themselves as this world power, that they're somehow more immune from this than the Americans. And then the Russian intelligence community, sanctioned by the Kremlin, is running an active disinformation campaign online, trying to blame us in the United States, the Bill and Melinda Gates Foundation, the US Army, for inventing this virus and for infecting Russia with it. That's one of the things that they're doing for their own internal propaganda purposes. So that's sort of the state of play in Russia. That's what's going on. I think if this wasn't such a huge story here and we weren't being so affected by it, there's all these places around the world where there's, the massive implications of the coronavirus. Hungary has kind of basically given up on democracy and has given all these emergency powers to Prime Minister Viktor Orban, a Putin ally. Turkmenistan has literally banned the use of the word coronavirus. It's now a crime if you say the word coronavirus that you can be put in jail for, whether you're a reporter or a person. And so these are all these kinds of things that, governments in Kenya, they shot a kid yesterday for being on his balcony during a coronavirus curfew. He was on his balcony and he was shot. This is all stuff that I think normally would be a much, much bigger story, but understandably, our primary focus as a news organization is on America and Americans and how this is affecting people and families, but worldwide. I mean, this is the big story in every country in the world.
Before we let you go, James, let's bring it back here to the US. I listen to your daily podcast every morning, and I appreciate you trying to end on some sort of like note of some sort of gem of light or a story that gives us some sense of hope, because otherwise, like, the reporting is quite bleak. Take us through what's standing out to you right now.
Yeah, this is bringing out the worst in people for sure. There was a story yesterday about how people are calling into Alcoholics Anonymous Zoom meetings and heckling folks, who are recovering alcoholics who can't go to AA meetings, but are calling into them from home. There's obviously profiteering. People are selling shoddy masks for huge markups, but there are a lot of inspiring stories of selflessness and acts of kindness. A 33-year-old leukemia patient was dying. There were limited resources in the hospital. He told the doctors, help someone who's going to live. Don't, do that with me. You're also hearing stories of, a newspaper delivery man in New Jersey is for no charge delivering groceries to elderly customers on his route that he normally drops newspapers off for. And then in my home state of Minnesota, a state trooper on Interstate 35 pulled over a doctor and she was speeding. And instead of giving her a ticket, he gave her some of those N95 masks that he had been given for his own protection. And he said, you need these in the hospital more than I do. You take them. That doctor wrote a really touching Facebook note about how what a meaningful gesture that was, and and how we really can get through this. So we're seeing the worst in some people, but we're also seeing the best, and those acts are inspiring. Sometimes it's hard to find the silver lining when you see numbers like we're seeing, but there are good people doing good things.
And Mary Beth, something that you were already reporting on and working on was sort of anxiety. And you were doing this great series about how you were sharing meals with people, how you were breaking bread with others. And the food section, there's always these interesting things around the new year about what are some food challenges, right? And you had this great idea of breaking bread with people around you. And of course, now that's been totally curbed because we can only Zoom with you.
I know. Well, for the entire month of January, I could only eat when I was with people. And so now it's like, that's, the
opposite.
Well, I think that's why, as James was talking about, it's so important to look for those bursts of joy wherever you can, and they are there to be found. And even when you do go to the grocery store and you do see people being kind to each other, and you do see people, tipping extra to people who are delivering things, and it does beg the question: what are things going to look like when they go back to normal? Because I don't think it's going to be the same. And I think that community aspect of it, I think that's going to be fascinating.
Yeah, well, I certainly miss seeing both of you in person, and it's the little things I think we all start to appreciate at this point, like those shared meals in a regular old cafeteria at our offices. So thank you so much to both of you. I want to mention that we'll be back here again on Friday at 3 p.m. Eastern time. And one of the things we're going to be looking at is this question of that stimulus relief bill and where things are going with the payout process. So if you have questions about that, you can submit them. We have a link in our chat on YouTube to the submission form at the Washington Post. And that form's also online at washingtonpost.com, where you can submit your questions. And we're answering them here, but also reporters all over the newsroom are looking in and sifting through these questions and answering them throughout their reporting processes. So feel free to send those in to us. Mary Beth Albright and James Holman, thank you so much to both of you for your time.
Thanks, Libby.
Thanks.
Thanks
So we'll see you again here on Friday at 3 o'clock. And I encourage you to subscribe. If you're watching on YouTube, hit that subscribe button, because we'll continue to bring you updates on this developing story. And you can, of course, subscribe to the Washington Post to support the journalism of my colleagues here. I'm Libby Casey, and I wish you well and hope you stay healthy and safe. And we'll see you on Friday.